Welcome to 2 Minute Anesthesia in Critical Care. Today we're going to talk about leptospirosis with synonyms including Wheals disease, rich water fever, and waterborne fever. We're going to discuss the spread, clinical features, diagnosis, management, and features relating to severe disease. A spirochete is a member of the phylum Spirochetota, which contains double-membrane gram-negative bacteria. These are long, helically coiled cells. The genus Leptospira contains 21 species, 9 of which are pathogenic. Leptospira are unique among the bacteria due to their morphology and shape and their presence of the periplasmic flagella, which is obviously located inside the cell in the periplasmic space, which is used to aid movement. Leptospirosis accounts for approximately 1 million cases globally per year, of which results in approximately 60,000 deaths. Within the US, more than 50% of cases affects Puerto Rico. When outbreaks do occur in high exposure, high risk groups, the incidence can be over 100 per 100,000 people. The carriers include rodents, cattle, pigs, horses, and dogs. Human-human transfer can occur, but this is very infrequent. How is leptospirosis spread to humans? So either directly through contaminated urine or indirectly from contaminated water, soil, or food. So how does leptospirosis enter the body? It can enter via the conjunctiva, and due to the mobility, it's able to penetrate mucous membranes, i.e. the GI tract, or injured skin. Controversy still exists whether leptospira can penetrate intact skin. Regarding the pathophysiology, so it enters the host, enters the human, it moves into the bloodstream, and reaches and colonizes organs, including the spleen, liver, and kidneys, and also produces an endotoxin, which can target intracellular components, including the sodium potassium ATPase. Clinical features. The incubation period lasts between 2 to 26 days, with an average of 10 days. This is followed by a primary phase where patients may experience fever, rigors, myalgia, headache in between 75 to up to 100% of patients. However, it's important to note that some patients may be asymptomatic. In severe cases, patients may progress to acute kidney injury, acute liver injury, and CNS infections, including encephalitis and meningitis. Important risk factors include temperature or tropical climates, occupational exposure, recreational use, and also house exposure, i.e. dogs. Diagnosis can be achieved via serology, molecular and culture analysis. Serology includes microscopic agglutination test, whereby you mix the test serum with a culture of leptospirosis and then evaluate the degree of agglutination using dark field microscope, in addition to ELISA lateral flow tests. Molecular includes real-time PCR and also culture of either blood or CSF specimens if antibiotic therapy has not been administered before the sample is taken. Management in mild disease, either oral doxycycline or amoxicillin, and in severe disease, intravenous penicillins or ceftriaxone may be indicated. Severe disease can result in organ dysfunction. This can affect the lungs in the form of ARDS. The heart can cause myocarditis leading to arrhythmias, acute kidney injury. You can also have a mild increase in bilirubin or transaminitis leading to an acute liver injury. It can affect the hematological system leading to thrombocytopenia or even DIC. And as mentioned, CNS infections include meningitis, encephalitis, but also intracranial hemorrhage, likely due to a reduction in platelet count. And finally, pancreatitis. Prevention is important. This includes avoiding high risk areas, the use of protective equipment, but also the use of prophylactic antibiotics in the form of doxycycline may be indicated. Thank you for watching, and if you enjoy our contents, please like and subscribe.